Hi, it's Dr. Z. This week, we'll be learning about substance-related and addictive disorders. This chapter is separated into 4 sections. The first 2 sections are substance-related disorders and non-substance-related disorders, and the last 2 sections focus on etiology and treatment of these disorders. So let's get started with this week's overview. By the end of this week, you'll be able to complete these district course competencies and learning objectives. For this week, please watch the overview video here. The first section is substance-related disorders. Substance use disorder involves a problematic pattern of use of one of 10 categories of substances, leading to impairment or distress. We will focus on the following substances: alcohol, sedatives, stimulants, opioids, cannabis, and hallucinogens. Please read the designated pages in the textbook and watch the assigned video, as well as complete the Nearpod lesson. The second section is the non-substance related disorders. The term behavioral addiction is new to the DSM-5 and is used to describe the experience of cravings, strong urges, and disruptions in one's functioning related to a particular behavior. Gambling disorder is the only non-substance related disorder added to the DSM-5 because of its similarities to substance abuse. Please read the designated pages in the textbook and complete the corresponding Nearpod lesson. Every week, the activity will give you the responsibility of being a psychologist for a day. Because diagnosis is so important to our role as psychologists, this week's activity involves applying your knowledge of substance-related and addictive disorders to a case history. For this activity, you'll be given the case histories of 5 different clients. And your job will be to diagnose the client assigned to you. This activity will prepare you for the discussion board. Additionally, there'll be 2 questions on the application paper regarding your client. The third section is etiology of substance-related disorders. The textbook focuses primarily on alcohol for etiology and treatment because of the large amount of research on alcohol abuse. It is important to note that there are 2 main perspectives on these disorders: biological causes and psychological causes. Please read the designated pages in the textbook and watch the assigned videos. The fourth section is treatment of substance-related disorders. There are 2 main categories of treatment for substance-related disorders, based on cognitive behavioral principles and biological treatment. So please read the designated pages in the textbook and watch these assigned videos. Let's go to the assignments for this week. The first assignment, as always, is the Nearpod lesson. This Nearpod covers the first part of the chapter on substance-related disorders. The second assignment is your discussion board on diagnosing substance-related and addictive disorders. This discussion board ties back to the activity of diagnosing your assigned client. For your diagnosis, or for your discussion board, you will share your diagnosis for your assigned case history. And additionally, I want you to engage in differential diagnosis for your assigned client. The fourth assignment is the chapter quiz. I encourage you to spend time differentiating between the types of substance use disorders and the related terms regarding substance use. There is 1 additional assignment this week. Well, because we're continuing to work on the film analysis project. The outline helps to prepare your paper and provide the needed structure. The outline will identify 3 different psychological disorders concepts tied to 3 different film scenes. Please remember that you will provide a description of the scene and just the definition of the psychological concept. There is no need to begin analyzing the film. I encourage you to see the samples and reference helps pages in the Film Analysis Project module for ideas. And finally, the last assignment this week is application paper number 10. Question 1 reviews the etiology of substance-related disorders and asks for a reflection on the TED Talk. And question 2 and question 3 have to do with the etiology and the treatment applied to your case history. And as always, question number 4 is your wow moment this week. If you're still watching this video, I'm going to reward you with extra credit. Carrie Fisher, otherwise known as Princess Leia to Star Wars fans like me, was open with her struggles with drug use and mental illness. She first reported using marijuana at age 13 and was diagnosed with bipolar disorder at age 24. After a couple stints in rehab, Carrie Fisher turned to writing to cope with her addictions. While she tragically died at the age of 60 in 2016, this quote expresses her desire to keep moving forward. If you want to earn 3 points extra credit, submit the author's name and extra credit Easter eggs on Canvas. And with that, my friends, you will have successfully completed this week's module. I look forward to reviewing your awesome assignments this week.